So my name is Tin. And then anybody wants to introduce himself next?
Hi, my name's Amanda.
Hi, my name is Sosen.
Hi, my name is Arso.
Hi, my name is Pichapa.
And today we're gonna do the
Tin, you're bugging out.
presentations for the information system policy development project. Our organization's name is North Star. Oh shoot! Can everyone hear me? Can everyone hear me?
Yes.
Yeah.
Okay. So the name of our organization is North Star Community Health Clinics. And we're gonna go to the first slides.
All right.
So that's your slide.
Um, yeah, you can hear me?
Yeah.
Can y'all hear me?
Yeah.
Okay. All right.
Mm.
So North Star Community Health Clinics is um a fictional nonprofit healthcare organization that provides both patient care and administrative services. Because of this, it handles a large amount of sensitive information, including patient records, employee data, and billing information. We chose healthcare as the focus because it's one of the most high-risk industries when it comes to data security, and healthcare organizations deal with extremely sensitive data like protected health information and payment details, which makes them a major target for cyber attacks. And on top of that, they must follow strict regulations like HIPAA for patient data and PCI DSS for payment security. And now, as to why these policies matter, in a healthcare setting, strong information system policies are essential because they directly protect patient privacy and financial data, and they help reduce security risks by making sure one authorized users can access systems, which is especially important when dealing with sensitive health records. These policies also support safe system changes and reliable recovery. For example, if there is a system failure or a cyber attack, having a proper backup and change management processes ensures the organization can recover quickly without interrupting patient care. They also create clear expectations for staff across departments so everyone understands how to properly handle data and systems. And more importantly, they help the organization stay compliant with regulations, like I mentioned earlier, like HIPAA and PCI DSS, which is critical for avoiding legal issues and maintaining trust with the patients.
Okay, so hi, this is Tin. And today I'll be walking you through the purpose of the computer data system access policy that I created, the controls that it established, and the regulatory requirements that it will support. So the primary goal of this policy is to ensure that access to all computer systems, applications, and electronic data within North Star Community Health is properly granted, modified, and removed in a secure, consistent, and fully auditable manner. Um, In addition to that, another reason that I have created this policy is because our organizations operate of protecting patient privacy, safeguarding organizational data, and maintaining the integrity of our information system are not just operational priorities, but rather legal obligations under the HIPAA and state of Minnesota's law. Therefore, I created this policy to establish a more standardized organization-wide approach to access management so that every user receives only the access that they need no more and no less, in order to maintain the topmost integrity in the organizations. So to make this policy actionable, I've defined some clear procedures for the process of requesting, approving, modifying, and also removing access. Um, so all access requests, whether new access, changes, or removals, must go through our official access request process using the designated form or ticketing system. Additionally, supervisors must review and approve each request individually, ensuring that access aligns with the job responsibilities of of the individual that requested it. The IT department would then validate each request based on minimum necessary standards and system security requirements. Um, Access is not going to be given without documented approval from both the supervisor and IT security team. And access removal is must be immediate upon terminations of employee role change or loss of authorizations. And supervisors are responsible for notifying the IT team immediately without the delay in these kind of situations. Period. Can everyone still hear me? It says my internet connection is unstable, so just want to make sure. Yes,
A
access
little wonky.
reviews will be conducted. I'm sorry.
It was a little wonky. You're good now.
Okay. So periodic access reviews will be conducted jointly by both IT security and department leaderships in order to ensure ongoing compliance within the organizations. Um, all access activities that are related to access must be logged and properly retained according to our retention schedule. And shared account within the organization under this policy are completely prohibited unless explicitly approved with compensating controls. And finally, users must complete required HIPAA and security training before access is activated under this policy. So I believe these procedures can help to ensure that access is tightly governed, traceable, and aligned with regulatory expectations. And then moving on from that, so this policy will directly support compliance with HIPAA security rule, including workforce security, information access management, information system activity review, access control, audit controls, and documentation requirements. It will also comply with the High Tech Act, which strengthens enforcement of HIPAA. It will also comply with the Minnesota Health Records Act and Minnesota Government Data Practices Act, which govern patient data access and state-held information. And then finally, it will comply with the Federal Information Security Modernization Act, or also known as FISMA, which will requires administrative, technical, and physical safeguards for systems handling federally funded program data such as Medicare and Medicaid. So by aligning with these regulations, this policy will reduce organizational risk and strengthens our organization's compliance posture. So oversight for moving on from that, oversight for this policy will rest within the Chief of Information Officer, also known as the CIO, and the Director of IT Security, who are responsible for policy approval, regulatory compliance, and enforcement. Department managers under this policy will be in charge of validating the legitimacy of access requests, and the IT departments will be responsible for implementing and maintaining the technical controls that support this policy. So in summary, this policy will provide a clear, enforceable framework for managing system access across North Star Community Health. It strengthens our security posture, supports regulatory compliance, and ensures that patients and organizational data remains protected at every stage of access life. So that's all that I have for my policy. We're gonna move to the next one.
So next we worked on was computer data systems change management policy. So Change management policy is important because it controls how changes are made to operating systems, which helps reduce operational risks. So first, all system changes must be formally requested. This means that nothing is changed informally, so every update is tracked and approved properly. Second, changes must be reviewed and approved before implementation. So this helps ensure that only safe and necessary changes are made, reducing the chance of system problems. Third, testing is required before anything goes live. This step is important because it helps catch errors or bugs before they affect real users or systems. Fourth, documentation must be kept for all changes. So this creates a record of what was changed, why it was changed, who approved it, which improves accountability and troubleshooting if any problems occur. And then finally, a backup plan should exist if the change fails. So if something goes wrong, the system can be quickly restored to its previous working state. So overall, the change management policy reduces operational risks by making sure that changes are controlled, tested, and are able to be reversible, which helps keep systems reliable in North Star community health.
Hi, my name's Amanda, and on this slide, I'm going to be covering our computer and data systems backup and recovery policy for North Star Community Health Clinics. The main goal of this policy is to protect critical systems and patient data from loss, whether that be from whether that is due to a cybersecurity attack, system failures, or just even human error. To do that, the policy requires regular backups for critical systems like those containing perform daily incremental backups and weekly full backups. Less critical systems are backed up at least weekly. Security is also a big focus. All backups must be encrypted both in transit and at rest, sorry. Access is restricted to authorized people only, which helps protect sensitive information like electronic. Another important part is recovery testing. We regularly test restoring them at least quarterly to make sure the process actually works and meets our recovery time and recovery point objectives.
Hi everyone, my name is Pichapa, and for my part, I worked on data classification policy. This policy is important because it's helped the organization organize data based on how sensitive it is. The goal is to make sure more sensitive information gets stronger protections. In our policy, we created for level of data. Classification, public internal use only, and confidentials and restricted. Public data is information that can be shared more freely, while restricted data it's the most sensitive and needs the highest level of security. So a very important part of this policy is that protected health information, or PHI, and payment card data always classify as restricted. That means they need stronger protection like limited access and monitoring. Overall, this policy helps employee understand what kind of data they are handling and what security control should be used for each level. And for this slide, show the four data classification level with examples that the type of protections each one needs. So the first level is public, which include things like website information. This kind of data only needs standard security control. The second one is internal use only, which includes things like protocol or schedules. With this information should stay inside the organization and only be shared with employee or approved staff. And the third one is confidentials, which includes more sensitive information like HR files or financials reports. This type of data needs stronger protection, such as role-based access and secure storage. And the last one would be the most sensitive level. It's restricted. This includes things like PHI payment card data and social security number. Because this data is highly sensitive, it require the strongest security control, including encryption, monitoring, and very limited access. So this classification system make it easier for employee to know how to handle information correctly and help support HIPAA and PCI.
So to wrap everything up, these policies work together to form a complete and practical security framework for the organization. The access policy controls the access policy controls who can see and use data, ensuring only the right people have access. The change management policy makes sure any system updates are carefully reviewed and tested to avoid disruptions. The backup and recovery policy ensures the data can be restored quickly in case of failure, and the data classification policy defines how sensitive different types of information, how sensitive different types of data are, and what level of protection they need. So, when combined, these policies don't just exist individually, but they support each other to protect sensitive information, maintain system reliability, and ensure compliance. This goes to create a stronger, more secure environment that reduces risk and helps the organization operate safely and efficiently while maintaining trust with patients and stakeholders.
Mhm. That's all that we have for this presentations. Thank you for listening. Stop.